Women's Health Symposium under the theme, The Role of Private Sector in Advancing Women's Health in Africa. This symposium's theme resonates with my own experience, highlighting the importance of partnerships and collaboration as a crucial component in advancing women's health. More specifically, how they contribute to access and quality healthcare by addressing the plight of mothers seeking care across the continent. This symposium has brought us together to remind us of the commitments we have made around women's health. It challenges us to take stock of our progress and consider how we can collectively forge stronger, more equitable, and accessible healthcare. Africa is still disproportionately burdened with poor indicators of women's health that undermine our collective resolve. Issues range from showing the highest maternal deaths as well as social injustices such as female genital mutilation, gender-based violence, teenage pregnancies, and early marriage. It is against this background that we are reminded of the 1994 ICPD Cairo Summit, where we made a firm commitment to be deliberate in investing in the health of women. At that time, we promised to end preventable maternal and child deaths. Since then, it's been a journey of passion, energy, and boldness that has kept us on track. Placing women at the center of economic development is essential, where women's participation in the marketplace is not only a powerful catalyst to realizing health equity, but also a pragmatic means of overcoming health inequity. This symposium brings together stakeholders and experts from across the region who have worked tirelessly towards building resilient health systems that promote Africa's healthcare agenda. Your hard work has been especially emphasized as we experience the devastating effects of the COVID-19 pandemic. We have all come to appreciate the importance of a strong health system. We are also united in the urgent need to reinforce our collective efforts in addressing the risks that threaten the gains we have made in women's health. This symposium also highlights the growing importance of collaboration and partnerships. The model of my Beyond Zero initiative is built on this same idea. It has been the defining principle and contributor to the success of the work. Our commitment to support the government to achieve the universal health care remains a pivotal part of the initiative's work. Forging relationships and bonds has been the backbone of our shared vision. It has helped us to collectively work towards the achievement of Sustainable Development Goal 3, good health and well-being. We have been privileged to collaborate with the private sector through the Beyond Zero Half Marathon, which has contributed towards accelerated action for access to quality healthcare through the purchase of fully equipped medical mobile clinics distributed in all 47 counties in Kenya. The investment in mobile clinics was geared to improve access to healthcare by serving the vulnerable and marginalized in hard-to-reach communities whose populations are less likely to access health facilities. The free health services provided by the mobile clinics have addressed reproductive health challenges facing these populations. More recently, we have expanded our focus to respond to unmet health needs through the Beyond Zero medical safaris. This program has contributed to strengthening our national resolve towards universal healthcare by enhancing the capacity of our health systems. There are many evidence-based examples around us of the power of multi-stakeholder partnerships and how these have influenced and scaled up positive changes in women's health. The life-changing stories we hear from across the continent have fueled our joint commitment to reverse adverse health outcomes so that no one is left behind. Through public-private partnerships and collective investment, we are urged to deepen our work around reproductive, maternal, adolescent, and child health. As we celebrate our work, we are, however, reminded that more needs to be done, especially around screening and detection of cancers, specifically cervical and breast cancers. These remain a growing concern with high mortality rates in our region. This forum convenes at a time when we face the risk of reversing our hard-won gains against the backdrop of the COVID-19 pandemic. The pandemic has tried and tested our health systems and further demonstrated the urgency of ensuring health and economic equity, especially for our women. The pandemic has called for innovative approaches to build resilient health systems. It's against this that I urge this forum to prioritize and dedicate resources that will advance our work around issues that negatively affect women's health. We must continue to speak with a unified voice and seek partners with a common vision. As a region, we can only stand to gain by accelerating substantial investment in women's health to overcome the challenges that remain, because women are still dying while they give life. We must be steeled by the possibility that we can achieve zero maternal and child deaths by devoting necessary expertise and resources. We must reaffirm our joint commitment, show unity, and declare that we are indeed in it for the long haul. I look forward to interesting deliberations and a fruitful symposium. I thank you.
I want to really appreciate Her Excellency, the First Lady, Mama Margaret Kenyatta, who has been a great champion for women health, women. Thank you very much. Let us appreciate her for what she has done for the Kenyan woman, for the African woman at a very personal level. I wish to take this opportunity to just recognize what has been said by many, that Africa has its challenges. I don't need to repeat the statistics, but we know that we have the highest deaths of women from birth-related complications, as well as leading incidences of adverse health outcomes amongst our adolescent population, a blot in the continent's civilization that we have painstakingly crafted together over the decades. It is indeed in gatherings like this that we are holding today that we must do a soul-searching, a deep dive that should bring to the surface pragmatic solutions beyond business as usual on matters of improving the health of women in the continent. I recognize the health of women in an equal socio-divided right as a right to a divided from our traditional blue-chip business investments. We can only draw dividends from where we have put our money. I challenge us to invest in improving the health of our women in Africa, and I reiterate to us what we all know, that investing in the health of women is not only the right thing to do, but is also a smart catalyst to the economic growth of a nation, and that was said here by other speakers before me. Honorable guests, ladies and gentlemen, the road to this symposium has been one that's been long and busy since the first symposium of this kind in 2016. And during that time, we have pitched tent in several cities in Africa to explore the best ways to tap into our collective strengths, both in the private and the public sector, as critical movers of a shared goal towards a better, responsive, and resilient health system for our people, and especially women, defined by guaranteed health equity within our borders. We have held that health is not a government-only agenda. It is upon this recognition that we meet here today to forge transformative partnerships that will harness the strengths and competencies that are inherent in the public sector and in the private sector, while scoring the very best lessons from each other and enabling each of us to put their worthy contribution on the table for us to create a resilient, quality, universal health coverage system for better health for our women. Indeed, we have all recognized here before that public-private partnerships is not new. And indeed, it is the concept of that collaboration and cooperation between the two sectors to be able to construct, to renovate, to manage, and to maintain the provision of health services to our people. And suffice to say, these partnerships are long-term mutual relationships in which risks are spread, shared for a common social dividend of